Good afternoon. I'm Allie Manson, the Vice President of Government Relations and Advocacy at Zero. I'm glad you all could join us this afternoon for a very special town hall conversation about what's going on in DC for prostate cancer. Back in March, Zero advocates went to Congress with our policy priorities, and we're here today to find out what has happened since then in both Washington and in state capitals across the country. Now, I know I promised you that we'd be joined by our lobbyist, Susan Sweat from Cornerstone Government Affairs. Susan's been unavoidably detained, so I'm sorry to say you only get this face today. And unfortunately, this voice, I can't seem to fix that right now either. But let's dive right in. So back in March, during our summit, we had 4 major asks of Capitol Hill in order to support prostate cancer patients. Right, the first one was the Prostate Cancer Research Program. That is the most innovative federal investment in prostate cancer research across the country. It's a program that is housed at the Department of Defense. It has yielded, in the last decade, 7 new treatments for advanced disease and 1 new diagnostic tool. It's incredibly effective. It's been funded at $110 million for the last few years. And our advocates went to the Hill in March to ask for $120 million. 120 million, that extra 10 gets us a few more investments, a few more grants. And what's so important about those grants, of course, is that they are investing in what are likely to be highly innovative, near-term diagnostics or treatments that might come to market. And in the course of the review process, we also have patients and consumers participating in the review process to make sure that the proposals that are being considered are the kind that are likely to be helpful to them in their lives, right? So our advocates and very many Zero volunteers and champions have over the years served as reviewers for that PCRP program. Now, at the summit, we asked members of Congress to sign on to what's called a Dear Colleague letter, right? A Dear Colleague letter is actually kind of what it sounds like. It's a letter a member of Congress sends to their colleagues, and it actually starts with the phrase, Dear Colleague, asking them for support for the program. We had 150 signatures on the letter in the House of Representatives. That is the most we've had in at least the last decade, and it is a really, really large letter. In the Senate, we had 22 signatures. That's almost a quarter of the entire Senate, right? That is, 22 doesn't sound like a lot, but in Senate terms, that's a really big letter. Excuse me, and what that means for us, practically speaking, is that we have a lot of members of Congress raising their hands and signing their names to say, yes, we support this research program. We think that funding for it is important. And we hope that when the Appropriations Committee, which is the committee in charge of doling out the money, when the Appropriations Committee makes their decisions, they consider the fact that so many members of Congress supported this program, right? And we often hear Appropriations Committee staff, there are a lot of programs, right? And there's only a limited amount of money. And they don't like the part where they have to pick who gets more money and who doesn't, right? It feels like choosing winners and losers. But if you have to do that, and you do, right? There's only a finite amount of money. If you have to do that, you want to make the right investments. And part of how you know you're making the right investments is that you're hearing from those members of Congress that this is what they support, right? So having a really big letter is a tool in our toolbox that we use to say, look, there are so many members of Congress who support this. It's a good thing. And therefore, you ought to put that extra $10 million that you happen to have for DoD health programs into the prostate cancer one. So the work's not over, right? Susan and I and Jamie, our CEO, had a meeting with the appropriations staff at the Defense Subcommittee 2 weeks ago, where we met with the staffers actually in charge of making some of the final decisions. And that staffer, we were able to say we had 150 signatures. We're going to have a similar meeting soon in the Senate. In the Senate, the staff will, they'll have a little bit of a different conversation. They have different ups and downs to it. But we know that in both cases, having lots of signatures is what really helps us. Anyway, and when Susan joins us, she's actually going to talk a little bit about oh, there we go. I'm sorry, Susan, we had some technical difficulties this afternoon. But I just caught our advocates up on how many signatures we got. The fact that we were then able to take that 150 signatures on that House letter, go to the House Appropriations Defense Subcommittee staff, and point to the fact that we had a huge number of members of Congress who support the PCRP. But not to put you on the spot, jumping in like this, but do you want to tell us a little bit about what comes next in the appropriations process? We'll meet with the Senate committee staff similarly, but then what?
Sure thing. And sorry about that, y'all. I've had some technical difficulties in this fun time that we live in. What comes next? We are awaiting the House. The House subcommittee is now starting to write the bill. We anticipate that we will see that defense appropriations bill for FY23 somewhere between mid to late June. So they haven't announced exactly which date we expect, but we anticipate that it will be marked up at a subcommittee level. So that smaller House Appropriations Defense Subcommittee will take that bill and will offer amendments and have a little meeting about that either the week of June 13th or the week of June 20th. And then the following week, so they wait about a week, and then the full House Appropriations Committee will take the bill up and do the same thing, offer amendments and hear others' ideas and insight. We think that at that point, the process screams to a lurching halt for our bill. Our bill right now has a lot of issues around its funding level. It is significantly lower than what the estimates for inflation are for the Department of Defense. Last year, we had the same problem. The House created a bill, and then at the end of the day, the House had to go back and add $25 billion more to their bill in order to get it through. The Senate actually negotiated that number amongst the Senate. Republicans and Democrats negotiated that number, and then the House had to follow suit. We anticipate the same thing happens this year. So we'll see it get marked up. We'll actually see what our number is in mid to late June, and then there will be no further progress until probably December on the legislation. The Senate will, it remains to be seen if they will actually mark up their bill or not. Again, that big debate about what that top line spending number should be is unfolding, and it doesn't look good, especially because we're in an election year. And when you are in an election year, which is every even year, the closer you get to November, the less time there is on the calendar to work compromises and the less incentive there is, right? Once we get past August, September and October are all just everybody yelling at each other and pointing fingers. Unlikely that the defense bill, which has an argument over its top line number, moves at all in the Senate. They'll come back after the election and make an assessment about whether or not they do the bill in December or whether they do the bill in January. What I'm telling you is like the prevailing wisdom. In this town, crazy can happen at any time. So there's always something that could change, and the clouds could part, and there could be some overwhelming need to pass a bill and everybody comes to an agreement. That can happen with disaster situations. It can happen with international situations, or some members can just stand up and decide they've had enough of it and they're going to get done. But the prevailing wisdom is that we'll see a number in the House in mid to late June, and then we won't see what the actual number is going to be until we get to December. So, Allie, does that give a good update for us?
I think that's part of what. So I think, well, I'll say frustrating for our advocates. I'll say it's frustrating for me, right? We've got a great program. By all accounts, it is effective. It's a great use of research dollars. Everybody likes prostate cancer research, right? Nothing controversial there, but we're part of a system, right, that's much bigger. It's part of the entire defense bill that funds the entire national defense process, right? So it's fun, right? That's just the world we live in. But we are so lucky to have, first of all, a program that's effective, right? I'd rather be advocating for something that works. And a great team of grassroots advocates and our champions and our advocates and our volunteers who can help use their voices and do chime in every time we ask them to. So, on the bright side, we got some wins there, even in a hard environment. And Susan, I was going through, we started with kind of what were our asks from from March. It's been a long year. And our next ask at the summit was about the CDC. I think though we don't really have a whole lot of news on the CDC front, but maybe you can catch us up on what to expect from that appropriations process too.
So the CDC is going to follow a very similar timeline that I've just laid out. We anticipate that the labor HHS bill is marked up at subcommittee, either the week of the 13th or the week of the 20th, and then the full committee either the week of the 20th or the week of the 27th of June. We do anticipate that we'll see the labor HHS bill, which includes funding for the CDC as part of the Department of Health and Human Services, or HHS. We anticipate that we'll see that go to the floor for a vote by the full House of Representatives in July. Unfortunately, on the Senate side, we have the same problem. They don't have an agreement on the top line number in the Senate. So in the House, it's majority rules, right? So go back to our old civics education. In the House, it's much easier with the majority rules just to say, these are going to be the numbers that we go with. In the Senate, there has to be a bipartisan agreement for what those top line numbers are. And that means the top line number for the Department of Defense bill and the labor HHS education bill. So they don't have an agreement on those. It remains to be seen if and when they will release those bills for people to see, or how they will handle marking them up. We're a little hopeful. I think we have a better shot at seeing that labor HHS bill come through than we do with the defense bill. But regardless, we anticipate that both will be gummed up in the process until December, and then they'll likely move together at the end of the year. So a little bit more of the same, but we're passing gateways, and that's what we want you to understand. Like there's not a lot to say right now. There will be something to say coming in June. We're hopeful that and somewhere between July and September, the Senate might do something, and certainly there will be lots of news happening around the December timeframe.
I hope what Susan's just explained to helps folks understand. We send out multiple action alert requests, right? You might get multiple emails that say, take action on the PCRP, take action on the CDC. And you might think to yourself, didn't I just do that one? I promise we're sending it again because we're at the next step in the process, right? There's all these steps, and at a number of them, we ask for your help. Use your voices, make sure your members of Congress are hearing from their constituents that this is important. So, just because you've received what seems like the same action alert email 3 times, I promise it's new. Click on it again. You'll make me feel really happy. You'll make Susan's job better, easier. I know it's crazy. Just roll with it. The other bill that we brought up at the summit this year that was new for us, and in fact, so new it hadn't even been introduced yet, we have really, really exciting news, right? We had the PC Care Act, what we described as it's a bill that creates a federal coordinating committee for prostate cancer research to help us ensure that prostate cancer research dollars are being used as efficiently and as effectively as possible to move toward a cure, right? That all these different agencies who are doing work are working together to identify goals, to identify gaps in research, to identify important targets, and then to make sure that they are coordinating effectively towards research success. And our big news, of course, was that in the month of May, I think last week, for National Cancer Research Month, Representatives Greg Murphy, a physician from North Carolina, and Representative Bobby Rush from Illinois came together and they introduced the PC Care Act, HR 7750. It was thrilling. You should have gotten an action alert, I think yesterday, about it, updating you and asking you to ask your members of Congress to reach out and to co-sponsor the bill. Susan, you want to tell us a little bit about how a bill like this works, what it does, and how we can move forward?
Yeah, so this is really exciting. And Allie and I have been doing some strategy sessions around our government relations goals and platforms. And I think we keep coming back to the idea that what we really need to drive a lot of our activity is understanding what's on the horizon for prostate cancer and how we can help you as patients, as survivors, as caregivers, connect to the best things from a treatment standpoint, but also from a community support standpoint. And making sure that we're connected is what this bill is about. It's making sure that we as a patient community are connected to the research community, and the research community and the patient community are connected to the funders of all of this work that's happening across the federal government. So it sets up a coordinating committee in the Department of Health and Human Services over at the NIH, the National Institutes of Health, and has that committee meet on a regular basis to in the first year to develop a plan for all the different aspects of prostate cancer research and what the goals should be for the community in prostate cancer research. So just a plan to build from and then to check against. And this isn't in a militant way, but this is in a way that brings all of our funders. You know, we talk about the PCRP, right? So we've got DoD funders, we've got funders in the VA and those at the NIH, along with the private sector and various other little agencies around the country, around the government, that are using what is coming out of research to inform the regulatory policies they're making, whether that's about coverage for certain new treatments or diagnostics, or the way that they create outreach campaigns and those kind of things. So we want everybody to get in one room a few times a year and hear from their peers, the leads of these organizations, on what they're seeing that's happening in research and what that might mean for our broader community. So it's an easy little bill that can be very impactful. So we are excited that that's been introduced now in this awareness month, and really hope that y'all can help us get some members to sign on as a co-sponsor to this bill. This is one of those bills that, with the appropriate attention from the committee and with a good bipartisan list of co-sponsors, should be able to move. Now, maybe not in this Congress. We'll have to see, because they're politics always gets in the way, but certainly, we would anticipate this is ripe for action in the coming years. And so anything that you can do to help jumpstart that, we would be greatly appreciative of. And the way you help us is by getting your members of Congress, your members of the House of Representatives, to co-sponsor the bill, which is really just a good government thing. Thanks. And that bill number, I don't know if we shared that, HR 7750, so 7750, the PC CARE Act, introduced by Mr. Murphy from North Carolina and Mr. Rush from Illinois.
And Greg Murphy's, in fact, a urologist, so this is a cause close to his heart that we can really lean on him to be a leader in this. The PC CARE Act is a good one, and I see a couple of great questions in the chat. Keep them coming. On Facebook, you can also post questions in the comment section, and we'll answer those too as best we can. I want to pivot quickly to advocacy in the states. We are always working in different states, and we've had an initiative called the Zero Cost to Prostate Cancer Screening Initiative. It has been intended to eliminate cost sharing for PSA testing, sometimes a little bit more than just PSA testing, for specific categories of high-risk men in different states over the last couple of years. The bill has passed in Maryland, New Jersey, and Rhode Island. It passed in Illinois in March, and we're waiting for the governor to sign it. We have every expectation that he will, but we're waiting for the governor to sign it. And that will put us at 4 states so far, and we're looking to keep going. There are bills right now in New Jersey, so our New Jersey advocates on here, please watch for an email from me, an email from Hal, asking you to use your voices there. Those are bills from Senator Troy Singleton and Assemblymember Herb Conaway. that would actually eliminate cost sharing for PSA testing, a DRE, as well as follow-up diagnostics to include imaging. So that's a pretty exciting version. We will keep doing that. We're going to look at more states for next year, maybe even one more state this year. Stay tuned. But do, especially if you are in, let's say, New Jersey and Pennsylvania. I'm not saying anything's happening in Pennsylvania, but just in case, if you're in New Jersey or Pennsylvania, keep an eye on your email and jump on anything that you get from me or Hal. We need your help. And in your own backyards, in your home state capitals, you can be even more effective than you can in Washington, D.C., right? It's amazing how small the world becomes when you're looking to change policy at the state level. Those are quick updates there. But I think we also want to talk about what you can do, right? You can get involved at the state level when we have that opportunity. You can click on action alerts every time we send them. Hopefully we're sending them just the right amount, enough to keep you busy, but not so much that you're overwhelmed. Let us know if you feel differently. Susie Schweinitauer, that fourth state was Illinois. Illinois was our state that passed in May. But you've got other ways you can get involved. So our fourth ask from the summit this year was the PSA for Him Act, right? That was a bill much like our state bills that eliminates cost sharing for prostate cancer screening for high-risk men. And we are doing a mini Hill Day on June 22nd in support of that bill, right? We're going to send advocates to Capitol Hill to target members of the Energy and Commerce Committee and the Congressional Black Caucus to really rally new co-sponsors for the PSA for Him Act. I know we've recruited people already. If you are interested in participating in that mini Hill Day, send an email to Hal, H-A-L, Hal at zerocancer.org, and Hal will help you figure out if you're in a target district, so much the better. That's our first choice. I'll be honest, we want you most if you're in a target district, but we love having advocates join us. Again, we love having new advocates join us. And, those mini Hill Days, Susan, what's so important about bringing our story back to Congress again? We were just there in March talking about this.
But March is about 20 years in congressional time, right? So like dog lives. So one of the things that's really important is to consistently get our message in front of members of Congress. We were there in March. We got a few more co-sponsors. Thank you for your help with that. We're sitting at 33 right now. We'd really like to grow that number to a level that makes this a bill that could really be actionable, right? So 33 is good and solid. I think we'd love to add another dozen members or so. And so if your boss isn't on the bill, that's, your boss. If your member of Congress isn't on the bill, then we'd really like to see them there. That's going to help us on getting it to move through the Energy and Commerce Committee. We know that it's unlikely. There's a whole list of things that the Energy and Commerce Committee is going to be doing this year, or not doing this year because, again, election year. So it's not likely that we move immediately, but the more co-sponsors we get, the higher likelihood that we have on this bill going somewhere at the beginning of the next Congress, so next January. And what is likely to occur in next January is that, and you've seen this probably on the internet, on the news, most pundits agree that the House is likely to switch from being controlled by the Democrats to being controlled by the Republicans. The Republicans are going to come out and want to have an agenda of a bunch of stuff they get done. We want to be on that agenda. We have a doctor, Larry Bouchon, who is our Republican lead on this bill. So he would be the one introducing it and trying to get it moving in a Republican-led Energy and Commerce Committee. The more people that we can get on in a bipartisan way this year, the greater our likelihood of being able to kind of get included in a list of priority items next year. So it's really important. And as much as, everybody loves me and Allie, but what they really love are their constituents. And when you tie it back to someone who lives in their district, you just, all the messaging that we do all day long is great. But when we have someone who lives in the district, they're gonna listen with different ears. They're gonna prioritize in a different way, and they're gonna consider action in a different way. And that's how you can be helpful to us. is coming alongside and bringing it back to your story in their district to make things matter. So we'd love for your help on the 22nd and trying to get some more co-sponsors on that bill.
And we're really lucky to have Mr. Bouchon or Dr. Bouchon sticking around, but Mr. Rush is retiring from Illinois. So we are also making sure that when we have those meetings in June, we're targeting hopefully a Democrat who could take his place as the Democratic lead on that bill, right? Because it's really important. All of our priorities at Zero, all of our prostate cancer priorities are bipartisan, right? We're working on both sides of the aisle. We want to make sure that no matter who's in charge, that is a relationship that we have and we've got issues that they can support. So if you want to participate on June 22nd, send that email to Hal, HAL at zerocancer.org. We can put it in the chat too. And Hal will help you get set up to participate. We'll do a quick training session. We'll make it very, very easy for you. And then we'll schedule you some meetings on the 22nd. And that's not all, right? We want people to develop relationships with their members of Congress all year long, right? We want you to be going to summit meetings. We want you to be reaching out to those staffers that you met with as things progress through the year, right? When a new bill is introduced, when progress is made in appropriations, whenever there's a place that you can provide new information and new opportunities, we want you reaching out to your members of Congress and their staffs, because that's how you build this consistent relationship. We want you to become a trusted source of information, right? And one of the other ways that you can do that is by visiting them in your home areas at their district offices in August during recess. So was it Mark or David? Oh, it was David McElhaney. Thanks, Mac, who asked what else you could do at the local level. In August, we want to send you to the district offices for your members. We will have another webinar at the very beginning of August. We'll put together a toolkit for you that helps you learn how to request a meeting, who to request it with. We'll give you asks and materials that you can share, and we'll walk you through the process of setting up those district meetings, because it's a really great way to continue to build that relationship and establish yourself as a trustworthy source. So there's a lot you can do at home, and we're going to do our best to keep serving those opportunities up to you in ways that make it as easy as possible for you to make an impact, right? Because it really is your stories, your voices. Susan and I can come in, we can answer technical questions, and we can back clean up, and that's great. But we're in a much better position if the process started with you guys going in telling your stories, just like Susan said. And we've already got people raising their hands saying they want to do meetings in August. That's awesome. Thank you, Jessica. Anyone else have other questions? Susan, anything else that we want to make sure to share? Ooh, Vivian, let me see if I can allow you to speak. See how good I am with webinar technology. All right, Vivian, why don't you go ahead? What do you have to say? You've got to unmute yourself.
I think I did. Did I?
We hear you.
Oh, great. Well, you guys are doing a great job. I intend to go visit my people. I try to stay in contact with them most of the time. They're not always here, but, talk to their folks. But I do run into them from time to time. So I intend to get out there and get among them and see who else we can reel in to get all of our asks answered, and answered the way we'd like them answered.
I love that, Vivian. You do a great job of maintaining those relationships. And you do, right? They're your representatives. They live in your communities, at least, when they're not in DC doing their day jobs. And I ran into Tim Kaine at the bar after my husband's high school reunion a couple of years ago. It's great. We're in Richmond. That was his hometown. But they're in your lives, right? They're in your communities. They're where you are. And you get to build that relationship, right? You get to make sure they know your face, they know your name, and they know what you care about. So
that's right.
And just having
correct.
having been one of those staffers, Vivian, I can still tell you, I can distinctly remember some of those constituents who cared about that one issue, who were respectful and kind, but consistent in their engagement with me on that issue. And it made me want to help them more, right? The more I knew them, that same face that was coming back year after year on that issue. I can rattle off a few of them right now. right? And 10 years on, think about those relationships that were created with those constituents from a staffer point of view. And that's what we just want to empower you all to be, are those same kind of constituents that can come in, create relationship with the staff, be their resource and their educator, but also help them understand the import of the things that we're asking for.
Can we make that our advocate motto? Respectful, kind, but consistent, or
Mhm.
persistent?
Persistent too. Yeah.
Thank you, Vivian. Do we
You're
have
welcome.
any other questions from the crowd here? We are happy to answer questions all day long, but I think we're trying to keep this on a reasonable timeline, give everyone back a little time in their afternoons. All right. If not, you always know how to find us. I'm Allie at zerocancer.org, ALI. And you can find me at that email, and I can always at Allie at zerocancer.org. And I can always pass you on to Susan, and we can say thank you and call it a day.